Hey guys, what's up? Thanks for tuning in. Today's video is going to be about Andrew Cuomo and the way he killed thousands of elderly people in New York by sticking sick people back in nursing homes. Alright, so it's been out in the news and the media recently that, it's come out that they were hiding the numbers that they were reporting, that the numbers they were reporting were drastically lower than what they really were because they were trying to avoid being scrutinized by the federal government and Trump. Okay, so I want to preface this by saying that all the numbers that I cite in this video are as of the time of the recording, so they're probably likely to change. But while I was scrolling through the various articles about nursing home deaths, right, I came across one article about coronavirus that said like 40% of all coronavirus deaths could have been avoided in the United States, and that the reason that 40% could have been avoided was largely due to the health issues of our country and like obesity and all of that we haven't addressed over the last 2 or 3 decades, and of course the way President Trump handled it. And I wanted to preface that 40% because it's going to come back into play here in a minute. To see, according to AARP, right, the nursing home COVID-19 death toll is around 163,000, depending on who you know. Like AARP says 160,000. I think the the New York Times says 163,000. Right? So as of this recording, 471,000 deaths in the United States from COVID-19, and 40% of that is 188,400. Right? So if you've got 160,000, we'll go with the lower number, right? We have 160,000 from the AARP in nursing home deaths, and that's what is reported. Okay, that's what is reported. That's not, including the numbers that may actually be from New York because they lied, right? So that's just what's reported. That's almost 40% right there. So we're talking close to 40% of all COVID deaths are from nursing homes and long-term care facilities. So Andrew Cuomo was given the opportunity to, he was given aid from the government. And they sent the USNS Comfort, right? It's like a big giant medical ship, right? So they send the Comfort to New York Harbor to help.
I'm here to express my profound gratitude to the dedicated service members who will soon be on the front lines of this fight. In a few moments, the crew of the Navy hospital ship USNS Comfort, which is really something, will embark for New York City, where they will join the ranks of tens of thousands of amazing doctors, nurses, and medical professionals who are battling to save American lives.
Right, so it docks in Manhattan, and it's got 1,000 beds. It's a full-on medical ship, military medical ship, Navy medical ship, fully stocked, ready to go. Boom, it's there, right? And at first, it was to help with to move patients from hospitals that, just need surgeries or just regular patients, move them out of the hospitals, and move them into this, into the Comfort so that they could get their procedures done and move on and be processed without the worry of getting COVID, right? But the COVID outbreak in New York was way worse than they anticipated or whatever, so they ended up, Governor Cuomo, contacted the president and asked if they could use the comfort for COVID patients instead of, non-COVID patients. Brilliant. I think that's a great idea, right? That's a brilliant idea. So I guess from what I understand, they got about 500 beds set aside for COVID patients in the comfort. In the USNS Comfort. After Cuomo asked Trump for that, right?
There is not a large non-COVID population in the hospitals. I'm going to call the president this afternoon and ask him to shift the comfort from non-COVID to COVID. And we don't need the comfort for non-COVID cases. We need it for COVID. If we had those two facilities as a relief valve, that would make a significant difference. Now,
Trump said, sure, of course, obviously, you whatever you need, right? Bam, does it. You know how many patients they treated? Like 180 something patients. You know how long that boat was in the harbor in New York? 1 month before Governor Cuomo said, no, we don't need it.
Manhattan today, the men and women on board helped treat 182 patients while they were here, and now they're on to their next mission.
We can show you some video of this ship in the Hudson as well. It is leaving exactly 1 month after first sailing into New York Harbor to relieve a hospital system overwhelmed by COVID-19. The naval medical ship discharged its final patient on Sunday. That patient was transferred to a local hospital to finish their recovery.
We don't need it. We've got this under control. I've got this under control. Then he goes on TV, starts cracking jokes with his brother about, COVID and, all of this. Then the guy gets an Emmy for his COVID briefings. This guy who killed over 13,000 people in nursing homes, and that's just what's reported. Okay? That's just what's reported by the New York Times. That's not actually the numbers that we're going to find out through this investigation that's about to happen. So, Andrew Cuomo, the guy who the media was lauding and touting about how great his handle of coronavirus was, turned out to be the worst thing to hit New York since Osama bin Laden. That's pretty bad, man. He killed more New Yorkers by sticking sick people, people that had COVID, telling them to go stay in nursing homes instead of going to the comfort, instead of utilizing the comfort for longer than a month.
Over 1 month, doctors and nurses on board saw 182 patients.
And treating only 180 plus patients. That's it. It's appalling. And he's not the only one. Go look it up. And I'll link it in the description, the New York Times. Nursing home deaths. Go look it up. Look at all these different Democratic states. A couple of Republican states had some high nursing home numbers, but like Florida, there's a lot of elderly people that live in Florida. So we kind of, I give them a little bit of leeway, even though, their numbers were still. I'll link it in the description. The New York Times, and you can look. A lot of these Democratic-run states have high death tolls in nursing homes. Ask yourself why that is. Thanks for tuning in. If you enjoy my content and you like this video, smash the like button, hit the subscribe button and the notification bell so you get notified anytime I put up a new video. Make sure to comment if you got something to say, and I'll see y'all guys later. Peace.